What is valerian?
Well, it's a herbal extract. It's a preparation that's it has some data to help with people who are feeling depressed and anxiety as well. It's sort of a tonic. People consider in the community to be a fairly benign and uncomplicated sort of treatment, and for most people, in fact, it is. It's
Well, you can buy it off the chemist.
You sure can, yeah. It's widely used, and most people would think of it because you can go to the shelf and pick it up off the shelf, like a lot of other things. You can paracetamol, you can do the same. That it's really must be safe because you can get it so easily, and it's not a drug. You know, they don't think of it as a drug, like a medication we might prescribe. And in fact, they think these herbal medications are harmless and shouldn't really cause them any harm. And so if they've got a small problem and a small fix, then really they self-help and self-medicate.
When you tell people that herbal supplements can do this kind of damage, what's usually the reaction?
Yeah, I think there's that general sense that these are very benign things, that how could a plant hurt me? It's natural. And the plethora of these drugs that make their way through as supplements, dietary supplements and herbal medications, and then things that are coming through from the internet that are a mix of things, a mix of pharmaceutical drugs and a mix of herbal drugs and a mix of God knows what that are coming through that we don't really know, because they're not passing through our standard checks and balances in our sort of medical system, and that's the sort of unseen iceberg here of drug-induced liver injury. Some of the herbal medications have better systems of assessment and regulation, but really we don't have the same purview over these drugs as we do and we expect. And I think patients expect, if they're going to get a drug, that there's a process, a due diligence, if you like, that has gone through. The most common one would be St John's wort, which is used for depression, and that interacts with a lot of the same pathways that metabolize St John's wort are antagonised for the metabolism of other drugs such as warfarin and some antibiotics. So that can make the levels of warfarin, you can bleed, it can elevate the levels of warfarin, or some other drugs can make it low, and you might need to be on warfarin for blood clotting issues, and your drug's made ineffective by the herbal medications.
Fish oil, I had no idea was a blood thinner.
Absolutely, yeah.
Green tea extract, I think, is probably the part that's concerning. It also gets a poor rap.
That's right. It can cause liver injury and liver damage, significant liver damage as well.
When I tell you something like 70% of Australians apparently use herbal supplements as a part of their primary care, you must get a little bit nervous.
Yeah, I think that begs questions. You know, what are 70% of people in Australia needing treatment for? Why do we need these medications? I think on the demand side, as a community, we're wanting to be fixed. We haven't really necessarily defined diseases that we're treating, but there's some mild element of disease, a bit of uncomfort or discomfort that people want fixed.
Hello, I'm Liz Hayes. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.